This is Paul Feuerstein, the editor-in-chief now of Dentistry Today, and it is my great pleasure, and this is not a canned statement, to have my dear friend and dental icon, Mark Hyman, Dr. Mark Hyman. Mark is the icon of the dental profession. If you don't know Mark, you haven't been to a dental meeting in the last 20 years. Mark is usually either the MC or the chief speaker or the practice management guru or teacher of all that has to do with dental practice. He's a resource to me, as a matter of fact, but most important, he's just a nice guy. And after many years of dental practice, Mark has moved into another area. He's gone as a adjunct full professor at the UNC School of Dentistry. And I think also some sort of a special assistant to the dean of the school too. And the beautiful thing here, Mark, is that you are now teaching the dentists of the future all the things they need to know. And if I say any more, Mark's head's not going to fit in the screen. So Mark, how are you today?
Paul, I'm doing great. Thank you for that kind introduction. When I hear that, I just wish my mother-in-law could hear it, but no such luck. I love dentistry. I love the privilege of being part of this magnificent profession. And for me personally, I'm a quadruple Tar Heel. So UNC Chapel Hill, undergrad, dental school, residency. And now I have the privilege of teaching at Chapel Hill. And Paul, congratulations on being editor of Dentistry Today. And you are an icon role model for many of us. And I think the reason they put you and I together, Paul, is we kind of lead the league in hair, just a different tint. But this should be fun. And again, I appreciate Philips for their attention and trust in us with this really important topic.
Yeah, and we want to thank Philips Oral Healthcare for helping put this whole thing together for us. And so let's just talk a little bit about what's been going on the past year. I mean, the understated thing is that COVID-19 has affected everything that you do in life. You get up in the morning and say, I was going to go to the store, but I need my mask. And dentistry itself has just really been just paralyzed by this whole thing initially, and now we've come out of it very, very nicely. So how do you see as it was unfolding the impact of what's happening to dental practices, Mark?
Right, Paul. It's kind of the multi-billion-dollar question, because dentistry, sure, like the entire world, got smacked down by this. I remember I was speaking in Washington, D.C., I think it was March 10th, and there was early rumblings of COVID, and no one on the plane had masks on, but you were kind of looking around and wiped off the tray table, and all of a sudden things just shut down. And I'll tell you, dentistry, as much as we got smacked down, dentistry has come back beautifully. And when I had the privilege of speaking during COVID to different organizations, I tried to remind them, dentistry's been through tough times before. Even just with my career, I was in private practice when Black Monday '87 hit, when the dot-com bubble burst in 2000, when the real estate market crashed in '08, '09, when both space shuttles blew up, when 9/11 hit. Dentistry's faced tough times before. And as far as infection control, when HIV, when the David Acer, Kimberly Bergalis case hit, to H1N1, to hepatitis, to HPV, dentistry has faced this before. So the reality is the profession got smacked down, and then I feel like we have come back better than ever. Several of my proteges told me that by the end of December, they had their biggest year ever. So it made me really proud of the resiliency for the profession, and how dentistry tried to work with best practices and true science and figure out how to take great care of our patients and our teammates and to keep ourselves safe. So, you know, I'll
interrupt and just say that it's important today, and even at that point, to say to patients, we've been isolating ourselves since the HIV started, and patients come in. Every patient comes into my office is a suspect. We've always worn masks. We've always had protective things on. We've taken it to another level, but we've always been in this ballpark anyway. So part of the problem is explaining this to the patients and giving them the confidence that they can come back to the office. Because part of the problem we had in Massachusetts, where I am, we were shut down by the state, and the state said, dentist offices are a horrible place to go. Hygienists shouldn't be cleaning teeth. You don't have to go in for your elective treatment recalls. Is it really elective? I mean, that really kind of in simple terms, screwed us a little bit. That the government's saying you shouldn't go and get your teeth cleaned because that's not critically important. And I think, especially working with Philips Oral Healthcare and so on, et cetera, it's the number one thing: prevention. So I mean, how do you see that whole thing?
Paul, it was very Dickinsonian to me. It was the best of times, the worst of times. The public's perception of dentistry, it was really fascinating and horrifying for us to be called non-essential, not necessary. And I think what people found out is absolutely dentistry is necessary. 40, 50,000 cases of mouth cancer found every year. The link of gum disease to heart disease, diabetes, low birth weight baby, premature babies, all the itises. So dentistry is absolutely critical. You think it's a bargain to wait to a small filling becomes a larger cavity, to a root canal, to an extraction bone graft implant. So dentistry is essential. And I think we showed the government how we were safe and how we were responsive, that we listened to the ADA and the CDC. And we tried to figure out best practices as fast as we could. There was a time that Dr. Fauci said that masks weren't critical. Well, that wasn't accurate. And so dentistry, we improvised, we learned, we grew, we stretched, we knew how to take care of people. We knew how to deal with spatter and splatter. And so where other professions may still be hurting, dentistry has come back better than ever. I think we already were in position to take care of ourselves. And I think to show our patients the value in what we were doing. So we absolutely are essential, and we are a critical part of the healthcare team.
But
If you think dentistry,
yeah, I'm
go ahead,
sorry.
bud.
One of the tasks that I've given to my staff is I said, every single patient that comes in, they know something's different immediately because they can't come into the office in the first place. And they have to fill out the forms and they have to have the temperature taken. But I say to every patient, every of the staff, the assistants, the hygienists, the front desk, when a patient's in the office, just casually mention one little thing. Say, boy, I can't believe the great work we had to do to make this office so safe for you. And when you're sitting there in this treatment room using a little vacuum system, this is unbelievable. This new vacuum system, it makes me feel safe, me as a provider. And what we tell our patients is also say, we made this a safe haven for ourselves. I have to come and live in this office all day long. I have to sit here. I'd rather be here than the supermarket, believe me. And I said, and you, Mr. Patient or Mrs. Patient, are invaders. So we have to look at you as the enemy in a certain way and say, but we're totally protected, and we are protected from you and for you. But we have to constantly remind the patients. Don't let it just say, they come in, they're looking around and, what's all this stuff? Tell them what it is. Put it on top of them. Way back at the very beginning, some of the offices were actually charging a fee for personal protective equipment, things like that. I don't think that's critical at this point, but to be demonstrative all day long and constantly reinforcing it to your patients and giving them the confidence to come in. And they'll say, gee, my husband didn't want to really come in, but when I tell him what you guys are doing, I think he'll come in. And
Paul, I
think
love that. I mean, I think the entire team has to be constantly reinforcing the message, which is we care about you. We're not going to spare any expense to make sure that you're safe because we're here too. Our families, our friends come here to get care. So we're all in this together. So this shouldn't never have been a political issue. When you've got a deadly, lethal, infectious virus, we did what we had to do to protect our patients and our teammates and ourselves. So I'm proud of the profession. Dentistry, I think we learned a lot about ourselves. I think we also learned how unprepared we were when you figure missing 2 weeks worth of work crushed some businesses, 2 weeks of not getting paid, not having income come in. So I hope for the future of the profession, dentistry says we need to save better. We need to mind our cash flow. We need to look at our budget, because this put a lot of offices in a difficult position. One of the cool things for me, Paul, you and I have spoken before. You took great care of your team for about 150 years. I had the privilege of 32 years in private practice. I had a level of love and loyalty from my team that was unbelievable. I had a receptionist for 25 years, my lead dental assistant for 19 years, 3 hygienists for 15. I talked to many of them during COVID, and they said they spoke to their significant others and said, I don't know what's going on now, but I know Dr. Mark, he would have taken good care of us. That was very touching to me. And I think this is an opportunity for some self-reflection for dentistry as well, to say, look at our priceless gems that we work with. I always said I worked for these women,
Exactly.
and are we taking great care of them? Because it takes so long to build a Top Gun dental team. And the fact that we had to furlough teammates, that we had folks leave the profession, it really was hard for dentistry.
That was a big challenge for us, that our lead hygienist had a baby in the middle of all of this.
Yeah.
And she panicked completely and says, I can't come back to work. And I kept saying, come in and see what we're doing. And she just still, to this day, said, I don't care. So, and there were patients who still, and this is another problem to face, are
So I think,
still they're not getting it. And they haven't been in so as to prove our point. And here's where we're having a problem with perio maintenance patients. I'm seeing patients now who were supposed to be in last March, haven't been in till now. It's almost like a year. And they say, yeah, I know. And all of a sudden, the hygiene appointment is not 30 seconds anymore. It's 30 minutes, 40 minutes, an hour. Come back for a second prophy, come back for a second deep scaling, and we're catching up. And the other thing, incidentally, in terms of the production, though, is that because of the protocols we have, in my office at least, it takes us a good solid 10 minutes to break down a room, clean the room. We actually happen to use a fogging disinfectant called hypochlorous acid after every single patient. And we got the noisiest machine we could find. And so patients go, what is that noise? Well, we're fogging the room. What does that do? Well, it gets into the areas, it gets into the aerosol, it gets into here, it gets into there. So again, part of the demonstrative. But what are we going to do now with, quote, catching up with the backlog of patients, of hygiene specifically, and getting them back on 3-month recalls and getting them back? We are the ones that reinforce the oral hygiene to them. We say, and every patient walks in, oh yeah, doc, I flossed yesterday for the first time in 3 months. Now I flossed yesterday for the first time in a year. So there's a lot of catch up to do, and not sucking up to Phillips at this point, but we have a big box of Sonicares in the office. Say, well, you know what? You've got to catch up. We have these special brushes for you. You can do things like that, and that's where things are happening for us in my own office. And it's just communication and getting it back. And then they realize, oh gosh, and as you said earlier, what about that little lesion that we were watching last year? Say, well, we'll check it the next recall, and now it's a year later, and all of a sudden you have this blowout. Oh, now what do we do?
Paul, I love the thought that we start with something positive with the patients. If they come in and stay, instead of saying you should have come in 12 months ago, saying,
Yeah.
thanks for getting in. We're going to take good care of you. We're going to figure it out. I'm a huge believer in intraoral cameras to use a picture so patients can see changes that are going on in their mouth. I always say show a good area first, then show an area of change. So if you see a lot of plaque and calculus, a lot of tartar built up on the lower anteriors, it's an opportunity to say, are you using your power toothbrush? Have you changed your Sonicare, your Diamond Clean head? It's been 12 months you've been smoking and drinking. I understand the stress. What an opportunity to whiten your teeth. So there's a lot of things that we can do as positives. If we have patients that haven't come in, Paul, we could do a Zoom call with the patient. So we sort of do a teledentistry visit to say, you're still part of the family here. First and foremost, not where have you been? You're costing me money, but are you okay? Is your family safe?
Right.
Is there anything I can do for you? You've been out of work. Do you have enough food to eat? What can we do to advocate for you? Secondly, you could give them a little tour of the office. Look at our new techniques and technologies that we've invested in to make sure that you're safe. While I've got you on the phone, you like mornings or afternoons? Let's go ahead and get you on the books.
Nice.
And get them in. There's another whole concept in dentistry, which I love. Paul, you've heard of it, I'm sure. It's the idea of seat, treat, complete, where we used to get people in for aerobic dentistry and running around. Doctor, you come in, you put on your PPE, and you do everything that you can at that one visit. So for somebody that's got active infection in their gums, why would you schedule them one quad at a time? Reserve an operatory and completely disinfect the mouth. Get them healthy again, get them caught up, then get them their Sonicare. An idea that we had during turbulent times, if finances are tough for people, why not, if they're going to do scaling root planing, give them the dang Sonicare. If they're going to do veneers and they're concerned about the cash flow, give them a Sonicare and say, this is how you're going to protect your investment in this cosmetic dentistry. So I love the thought of us partnering with Philips and saying, with touch-up kits, with day white, night white, getting them in for a Zoom, using your Sonocares. These are things that if we've got them sitting on the shelf, let's get them out into our dental family. We've already paid for them. So let's get them out into the dental family and get people healthy and get their teeth white again. It's a huge opportunity to add benefits during tough times when people are trying to decide, do I spend discretionary dollars on dentistry?
We actually took advantage of some of that. So around Christmas time, we sent out notes to the patients that saying we have a special on, all these things that we can give to the patients, and
Love it.
buy one, get one free, or, it's a Christmas gift, what a great Christmas gift to give to someone who hasn't been into the office. We made fun of it, and we did pretty well.
It's a wonderful thing, Paul. You can use your practice management software to send out a newsletter
Oh yeah.
saying, how about a white Christmas? How about let your teeth sparkle like the 4th of July? How about you're engaged? Congratulations. Things I talk about in the seminars, for the questions that you ask a patient when they're engaged. Congratulations. When's the wedding? When your daddy walks you down the aisle, what do you want your teeth to look like? And can I give you an engagement gift? We do 2 for 1 for the mother, the bride, and the bride.
Wow.
The bride and the groom, the whole wedding party. What a great opportunity to get them into the office and get their teeth whitened. That's a huge opportunity to build value.
Well, there you are. That is Dr. Mark Hyman's practice management tip of the day. I mean, I got to tell you, Mark, I've spent so many hours watching you and jumping up and holding my hands up in the air for some strange reason. I forgot what it's all about. You've been such a gift to dentistry, and I really say that sincerely, even though you're my friend. That's from the heart.
You're very kind, Paul. Thank you, bud.
And so I guess we should wrap it up a little bit here. So let's first thank Philips Oral Healthcare, and I thank you so much for this opportunity to talk with Dr. Mark. Mark, I haven't seen you in such a long time, so thanks for letting us, just sit and talk for a while. And if you need further information from the Philips website, here is the URL for dental professionals, and there's also a direct link below in the description. So thank you. And Mark, I gotta say, I miss seeing you. I miss seeing my dental extended family. We have to get this thing under control. We have to get to some dental shows. We're going to reinvent the whole process somehow. Good luck to your Tar Heels, by the way.
I thank you. They need it. So, Paul, I've got the privilege of speaking Chicago Midwinter coming up in a few weeks, which is going to be virtual.
Yes.
But Hyman, which is an unbelievable meeting in Atlanta in March, is part virtual and part
That's correct.
in person. And so there's 20 some speakers, and I'm humbled to be one of them, to be speaking in Atlanta this March. So it's limited attendance, but unlimited on Zoom. So it's happening. The meetings are recognizing that we can slowly get back together. People are getting vaccinated. Everyone's going to wear their mask and just protect each other and get through this thing. Paulie, one of my favorite things, being a rock and roller that you are, the future's so bright, you got to wear shades. You remember that? And that's the way I feel about dentistry. We so appreciate partnering with Philips with their immaculate products that do a huge benefit to our patients and a joy to work with when you're in private practice or in industry or in education. So for everybody that watches this, Paul, I appreciate your leadership for dentistry.
Thank you, Mark.
Philips, I appreciate their innovation. It's always something new with them. And I know they've got some really cool things coming down the pike that they'll share with their audiences internationally coming up in the next year. But everybody just stay positive and fight hard. We're going to beat this thing, and we're going to come back better than ever. I promise you.
That's great, Mark. And I can't leave that. Everybody has seen my tie, and if you don't know what it is, I may as well tell you the secret. This is the adapter for a 45 RPM record, which is something that some of the young people never heard of. And I just want to show you, we talked about staff. I have an assistant named Carla, who's been my dear assistant for over 20 years. And this is what her Christmas gift to me was, my brand new 45 mask. So I leave you with that thought. And I want to thank you again, Mark. And thanks to Dentistry Today for putting this together for us also. And thank you, Philips. And everybody, stay safe, be safe, have common sense.
Thank you, everybody.